I want to give a trigger warning. Um, I'm going to be talking about mental and physical disabilities. Yes, I'm already crying. It's very hard to talk about my past without crying. So I've made a list of my mental and my physical disabilities, and I wanted to go over them because so many of you have told me that I not only inspire you, but what I do for myself motivates you to want to do better for yourself. So I figured if I talked about the struggles that I've had my whole entire life, that somehow maybe it could help you, for you to keep fighting for yourself, and for you to be your own advocate. Because, yes, our parents want us to be better. Not one of mine. My dad does. And who more is going to want you to get better than yourself? Like, nobody wanted me to get better more than me. So, of course, I had to fight for myself. I have seen hundreds of doctors and therapists and specialists and surgeons to get to where I am today. So I want to start first with my mental disabilities because, well, they kind of go hand in hand, actually. Not only do I have a bunch of medical disabilities for my body, my mother beat the fuck out of me until I was almost 12. And that didn't help my body at all. She ground my hands together. She ground my feet when she tried to put our shoes on. She beat me with whatever she could find. She pulled my arm out of socket all the time when I was a kid. And she beat the fuck out of me. Where I was thrashing around. And if I accidentally kicked her, she beat me like 18 more times. So I know that even though I have all these genetic disorders that some of them I've had since birth, I know her beating on my body for 12 years didn't help me at all. And I'm going to be 39 next month. And I've been going to advanced physical therapy for almost 2 years. And Kayla has helped heal my body a lot. Now, the reason why I never made this video is because I cried during the whole thing. And I'm gonna cry during the whole thing. I'm sorry, guys. I can't. You know, there's a lot of women at advanced physical therapy that are so motherly and loving, like Gretchen and Carol and Kayla and Laurel. And they've told me you should make this video because this is you. This is your life. This is how it's affected you. And I've always been afraid to make it because I do cry so much. You all know that I'm in a very good place in my life, mentally and physically. I still have a long road to go. 3 years ago, I've fought for myself. I finally got up out of that bed, out of that mindset, and I started healing myself. Okay, so, sorry. So, I figured if I told you guys the mental and the physical, basically gymnastics I've had to go through all these years, that I could show you. I will never say if I can get through it, you can. I won't do that to you guys because every person is different. Every person's life, mental and physical disabilities are different. But I believe in you that you could get through it. Sometimes it takes other people to talk to you. Sometimes it takes a motivational quote. Sometimes it takes seeing somebody else go through it and get through it. So I'm just going to go through the list, and I'm going to try to explain things as best as I possibly can without veering off too much from the topic. So I'm just going to go through the list, and then I'll talk about it. So I have something called misophonia. Okay? I've had I've had most of these my entire life. And I'm just now dealing with them. Like, I've been able to process through them with 22 years of all different types of therapy. Um, so I have misophonia, anxiety, major depression, short term memory loss, post traumatic stress disorder, obsessive compulsive disorder, attention deficit hyperactivity disorder. With my borderline personality disorder, I have all of the characteristic traits. I have fear of abandonment, unstable relationships, unstable self image, impulsive, risky behaviors, self harm and suicide, intense mood swings, chronic feelings of emptiness. I've told you guys that, where I feel like I'm falling down this dark tunnel and pit. Explosive anger, paranoia, and disassociation. Um, I've also have flashbacks, really bad flashbacks, and something called like you call it daydreaming, but it's basically like day night terrors. I have horrible flashbacks, and I have negative and positive triggers. Okay, so those are my mental disabilities, and then also I suffered from 3 different eating disorders from a young kid into basically till I was like 26, 32. I had bulimia, anorexia, and I also binge ate. And I kept that a secret. I don't think I really told many people that I was a binge eater. Okay, so those are, like I said, my mental and my physicals. Also, besides the eating disorders, is something called generalized hypermobility spectrum disorder. I will get into each one of them. I have vertigo. I've had that for about 5 years. I'm just getting that healed and cured now. I have something called fibromyalgia, and I cannot remember the name, but it's a disorder with your fascia, and everything is a connective tissue and is surrounded by fascia, like even our cells. I have tendonitis all over my body. I have arthritis everywhere. I also have bursitis in a few of my joints. My bladder went. I am on bladder medication. My uterus was affected, so I had to get it burned and my fallopian tubes taken out. I also have problems with my eyes. I have astigmatism, and my eyes swell and unswell. And I have dry eye disorder, and also my glands don't produce enough oil. Okay, so that's all of them that I can remember. So I'm going to go through them. For my mental disabilities, like I said, they go hand in hand. When you're in as much pain as I was in, you start, what's the purpose of living? Why should I wake up tomorrow and suffer? Why? What's the purpose? I'm just gonna wake up tomorrow broken. So the more pain I was in, the more my disorders, my mental disabilities were affected, and I really couldn't get my shit together at all. Um, I can't remember the name. I tried looking it up. We've done so many different forms of therapy. Hypnotherapy, family group. I've had DBT counseling one-on-one because I couldn't do it in a group setting. I didn't mean group. I meant family together. David's done play therapy. I've done that when I was younger. I've had crisis and counseling. I've been admitted to the hospital, a psychiatric ward when I was when my mother left, and I didn't know how to handle not being beaten every day or treated like shit. And I guess that's like Stockholm syndrome, now that I understand it more. Um, so I rebelled because the only attention I got was negative. We didn't get, I'm proud of you, oh, what a great job you did. It was, oh, you did better than me, like I'm jealous. Um, I don't want to go too much into my past and my mother. I've talked to you guys about her before. She's a monster, I guess you want to say. An evil, disgusting piece of shit monster. I couldn't do anything right. When I was younger, she told me she hated me. She wished she never had me. I ruin everything. I break everything. I can't do anything right. I'm so stupid. I'm an idiot. Um, she took all of her anger out on me. My sister Crystal got hurt too, and Katie was, she didn't get hit as much, but we all got mentally fucked over, and she used food as a weapon. She used anything as a weapon. Like, I didn't have a good relationship with food at all until about 3 years ago, or 2.5 years ago. When I became a vegan, I've seen nutritionists to try to rebuild my relationship with food and not use it as a weapon for myself or as a coping skill. I'm sorry, I'm going to be all over the place. I have ADHD. It's really hard for me to keep track. That's why I made a list, but I'm sorry if I can't. I'm not emotionally stable because right now, because I just found out that I also have a heart problem. So I see the doctor tomorrow for that. I can't remember on the top of my head what it's called. Okay, so fuck. Jesus Christ. I'm not even going to wipe my tears. They're just going to fall. I'm just going to keep crying because it's emotional for me to talk about all this stuff. Like, it's hard for me to see that this was what my life was like. But then I think about that this is what I overcame. And now I live a life with disabilities instead of my disabilities living my life for me, if that makes any sense. My triggers used to be so bad that I couldn't stop crying and getting lost in my own mind for sometimes weeks and months at a time. Oh, God. Sorry, what I was talking about was the different types of therapy I've had. We used to have counselors that would come to the house too, and one would be for David and one would be for me, and then we would have family therapy. That's what it was. It wasn't group therapy, it was family. We would do it together, and then we would have our own separate counselors. I've done counseling therapists. I've done, what are they called? Psychologists and psychiatrists. I don't feel like I need to have therapy right now, but if I ever did, I would 100% go back to therapy. Like, there's no doubt in my mind. I'm not the type of person anymore to be like, oh, there's nothing wrong with me. I know there were things wrong with me. That's why I sought out therapy. Because I knew that the way that I was behaving and the things that I was saying and thinking in my own mind about other people and myself was not healthy. And I wanted to be better. I wanted to be a better version of myself, and I wanted to treat my body better and my mind. Some of my flashbacks come from an old song, something on the television. If I hear my mother's voice, her laugh, having, like I said, a flashback, it'll just come back, and I will just hysterically start crying. Some of them are on a physical level. When Kayla was working on my body, when she was massaging me, I would just start hysterically crying out of the blue because I didn't realize you held on to your, what are they called? Your actual physical, not accidents, what do you call it? Injuries. So every time I would hurt myself and not get better, honey, close the door before the AC gets out, sweetie. Thank you. You hold on to those. And then, like, she would work on my back. And when she worked on my back, especially my shoulder blade, I was 7 years old again, with my mom pinning my arm behind my back and shoving my face into the ground. So even though I knew I was on that table, I'm 38 years old, I was that 7-year-old again, reliving that injury because it hadn't hurt like that since the very first time it got injured. Or I remembered falling down the stairs and smashing the door jamb behind my shoulder blade. So all those injuries came back up while she was massaging me. These are called negative triggers. Sometimes I'll have positive ones where, like, even though I'm crying right now, like, that one time where I made that video, it's still on my Instagram. I was sitting in the car and I realized I could open the door with my left arm. And I lost it. I cried for like 5 straight minutes in complete shock and joy that I could do that. But then you also think that I've had to use my right arm and use my foot to kick the door open for all these years, over 20 years. So those are some of the positive triggers. I don't have too many positive ones. A lot of them are negative. And that's what the triggers make me have, the flashbacks. And then I also have misophonia. Stop, baby. Stop. It's that. My dog's drinking out of the bowl and I'm losing my shit here. So I can't handle it. Not right now. For me, it's not just noise. It's sight and it's the feeling of something. I also have, I forgot, sensory overload. My sense of smell, my sense of taste, and my sense of touch are get overloaded as well. Like if you go to rub my arm the same way like this, I'm like, ugh, and I can't stand it. So misophonia is like a complete enragement. Like I have rage that just flows over my entire body from noise or the feeling. So like I'll sit here and build and my son will lay on that beanbag chair and he'll shake my chair. He'll shake my whole table. Ooh. And I'm like, please stop. Like I can't deal with that. And that has put a rift in a lot of my relationships too, because like my ex, he would shake or click a pen to help him get through his anxiety or him being nervous or thinking. That's his process. And I couldn't handle it. I'd like put my hand on his leg, like, please, like, fucking stop. Like, you're driving me nuts. I've worked a lot through that. That's DBT counseling one-on-one with my psychiatrist that really helped me center myself and breathe and concentrate and try to figure out why I was being overloaded with emotions and work through it. And every therapist and counselor and hypnotherapist and psychiatrist, and they all told me to take a second to breathe. And I never believed them. I just shrugged it off like that was the stupidest shit I'd ever heard. And for me, that's what I do. When I get completely overloaded, I stop and I focus on breathing. And I say, even to adults and children, you are smelling the roses and blowing out your birthday candles. That's exactly what it's like for me. I envision myself breathing in a beautiful flower and really smelling that flower and then blowing out my candles. And that gives me a few seconds to concentrate and say, do I want to flip out? Do I want to scream at somebody to shut that fucking pen up? Or do I want to turn around and say, I'm sorry, I have misophonia. Can you please stop clicking your pen? I feel like I'm going to lose it. Like, and now I could just be like, I'm sorry, I can't handle the pen. Can you please stop? And they'll be like, oh yeah, that's fine. I'm not kidding. I had to switch from college in person to college online because my misophonia and my anxiety and my paranoia and my ADHD was so fucking out of control. I would turn around and scream at people. Scream at them because they're clicking a pen or asking questions in class. I'm like, write the fucking questions down and ask the questions after class. Like, I pay for this class, stop interrupting. Like, and then I would cry. I'm like, that's not me. I'm sorry. I don't know what's wrong with me. I didn't get diagnosed with misophonia until I think I was 36, I think. And adult ADHD until I was like 36. But and then my short-term memory, that really affects things. That affects my relationships because people think they're not important enough for me to remember. And I'm like, it's not that. You could tell me, be at my house at noon at 9 o'clock in the morning, and I will forget a couple seconds later. I have a bunch of coping skills that I use, or coping mechanisms that I use for that. I set a lot of alarms. So if I have an appointment at 1, I set it for 9 to tell me I have an appointment, 10 o'clock to remind me about that appointment, 12 o'clock to get ready, and 12:30 to leave, because I will forget within a half an hour that that alarm just went off. And even, you know, my family, some of my friends are like, are me and my kids not important enough? And I'm like, that's not it. You know how much I love you. You know how important you are. But I have short-term memory loss. And like, if you don't understand that a lot, I'll try to explain it, but even looking it up helps people understand more. Especially my misophonia. Like, I didn't even know I had misophonia until my dad was looking into why my sister Desiree was so affected by noise. And he wrote online, he's like, wow, this really is a disorder. I feel fucking awful for pretending like it wasn't real. And then I looked it up and I'm like, holy fucking shit, that's what I have. So I went and had a bunch of therapy and stuff and got diagnosed. And it's not enough just to get a diagnosis. That's what my mother used to do. She'd get her diagnosis and think she was healed and like, oh, this is what I have and this is the reason why I act like this. No, you learn about your disorder and then you learn how to get better from it. Not, oh, this is why I treat you like this or this is why I talk to you like this. No, you learn to get better, or you try to. Like, that's the way I was raised. I got all these diagnoses and now I'm 37 years old learning more and more about them, especially borderline personality disorder. With my mother, she said she would tell people she had split personalities. So right before I stopped talking to her, I'm like, you do realize BPD isn't multiple personalities. It's not dissociated identification disorder, or DID. I don't know if I got that wrong. Like, it's borderline personality disorder, which is all of those things. Fear of abandonment. I couldn't handle changes, or, you know, I was always afraid people were going to leave me and hate me and not like me at all. I had horrible unstable relationships. That's why I've been single for 7 years too, because I'm trying to heal myself mentally and physically as well. And I wasn't good for anybody. I wasn't. I obviously didn't like people or relationships, and I didn't want to deal with that shit either. So I spent the past 7 years helping myself mentally and physically. I don't just have horrible, unstable self-image. I hated myself. I had horrible body image problems. I don't remember what it's called. Where I would look in the mirror and I would literally say, you're fucking disgusting. Like, look how gross and nasty you look. Like, I said those things to myself. And I didn't even know how bad I was hurting myself until one day I was looking in the mirror like a year ago and I was like, wow, I look so skinny. And my son was shocked. He's like, oh my God, Mom, like, I've never even heard you say something positive about yourself. Like, I've never even heard you say that. We cried and we hugged each other, and he hugged me while I cried. And I was like, oh my God, like, why have I been so mean to myself? Because I learned it. And because my mother was very mean to me and she said those nasty things to me. When she would see, like, I got really big. I was like 339 pounds. And my shirt would like lift up. And I would see my mother's reaction in the mirror. And my own mother would have a look of disgust on her face. And that shit would crush me. She was very fucking mean to herself and me and my son and our friends and our family. So So it wasn't just like, I mean, I guess that's what unstable self-image is. Like, I hated myself. Impulsive, risky behaviors, really fast, quick. Oh, you want to do that? I'm gonna buy everything for it. You want to go do this? Let's go do it, and let's do it right now. Now I make plans. I make time for myself. I don't have risky behaviors anymore. I used to be very dangerous. I didn't really care about my life or myself. And really until I had my son. We talk about this, my son and I do. It took me over 18 fucking years to heal myself from what I went through for the first 18 years of my life. And I've always apologized to him too, because I wasn't stable back then. I had a lot of fucking problems. And raising a child on top of that alone was very hard for me. I was very angry, and I feel really, really bad. We've already talked about this, and a lot of people don't know. This is another trigger warning, okay? I guess all of this is really, but I used to cut my arms, and I still have scars on both of them. When Lori first left, I didn't know how to deal with any of it. So I started cutting. And I found a razor blade, and I would take my arm, and I would cut and cut and cut and cut and cut and cut. And because of my OCD, if I had a cut outside of that straight line, I would just start another full line. Some of them got too deep. Maybe someday I will show you my scars. But they're not as bad as other people's. I'm glad my grandma stopped me before it got worse. I put a long sleeve shirt on because she was coming over. My mom didn't pay attention to me like other people did. My grandma noticed right away. Just from a couple of lines of blood on my shirt. And maybe I wanted her to find them. Maybe I wanted somebody to care about me and ask me why I was doing it and help me. Maybe that was a cry out for help. But she's like, you don't need to do this. I'm always here for you if you want to talk. And then I tried to hang myself when I was in 6th grade. And then I took a bunch of pills. And I was just a 12-year-old, 11-year-old little girl, not knowing even how to handle anything. So I think I tried to kill myself 3 times, and it didn't work. And I was put in a mental institution, and I was put on Prozac, which made me start hearing voices and seeing people who weren't there. And I know this is very weird, but I had Casey Kasem and a film crew following my life around, and they narrated everything in my head, and it was very fucking annoying. And I didn't know it was because I was having a mental breakdown at 11 or 12. I can't remember the exact year. I had always had thoughts of suicide, but I don't think I ever tried to kill myself as a young adult. David really helped keep me alive just by being bored. He helped save my life in so many ways I don't think even he knows. And I'm here today because he's my son. And I wanted to be there for every second of his life. And just love him unconditionally. Like, I love him so much. He's just the best thing that's ever happened to me. I wanted to be better because I was now a mother. I wanted to be a better mother, a better friend, daughter, sister, and just a better human in general. and be better to myself, because whatever I was going through, however I was reacting with situations, reacting with my friends, how I talked about myself, I learned as years went by and he got older that I was going to instill those same mindsets with him. I never wanted him to ever look at himself in the mirror and hate what he saw, like I did. I wanted more for him. I wanted him to love himself like I loved him. I had horrible, horrible mood swings. I mean, like, some of you that are watching this have known me for the past 7 years since I moved here to Winthrop. And you know that when the kids would be over and they would be making a lot of noise, I would lose my shit and I would switch like that. They were so intense. They felt like a light switch. I would be completely fine and then I would be screaming and losing my shit. And I learned from my mother that I had the same things. I never shut the fuck up. I just kept going and going and going and going, and I was an annoying fucking asshole. And then I would be fine. And then I would cry again and be mad, and then I would be fine again. The chronic feelings of emptiness. Oh boy, where to even begin with that one? I just felt so alone and just empty. Sometimes I didn't feel anger or happiness. I just felt empty. So fucking alone and empty. Like I was falling. Like I say, down a dark, cold, lonely tunnel. Just falling. And I can't seem to get myself back out. And you just can't seem to pull your shit together and just make it through the day. Just one more day. I had a horrible explosive anger. That was the mood swings as well. The anger was so fucking consuming, and I was sick and tired of it. And I know in another video I said that I feel like I picked up my mother's disabilities. That's easy to do. When you live with somebody that is fucked up as my mother is, of course you're going to live like that and think like that and be like that. And that's why I wanted to literally nip it in the fucking butt before my son started being like that. And he did. I mean, he was suicidal at 7. He's struggled throughout his life, and I've always brought him to the doctor and gotten him whatever therapy he needed, because I knew that I was the cause of some or most of that. And I'm okay with admitting that my mom fucked me up and I fucked my son up, and it was time to stop the fucking cycle. It was I don't want my son to feel or think the way that I did my life. I want better for him. I want him to love himself and feel like he's good enough. You're always good enough for me, okay? I love you.
Only have an hour left.
Okay, I'll be done in just a second. I'm still just learning about disassociation now, because I thought I was just a worrywart. I didn't know that I was paranoid all the time. I still am. I'm a very paranoid person. I'm still working through that. I say, I just worry. I worry a lot. Yeah, it's paranoia. And then some of you have asked me how I was able to get through emotionally what's been happening with the coronavirus. Unbeknownst to most of you, I have horrible paranoia and panic attacks a couple of times a year, maybe 3 or 4 times a year. And now it's not just, God, how do I explain it? The world's gonna end. how are we gonna live? How are we gonna survive? Are we even gonna be home if we get a bunch of shit in the attic and like get water and foods and what are those MREs?
Meals ready to eat.
Meals ready to eat. And like, do we need to get all that? Like, we're gonna all die. We're gonna have an atomic bomb. And then the virus came, and I was like, oh my fucking god! I did panic. I panicked for like a full week. Um, uh, then getting Ariana. Sometimes I will have complete fucking paranoia meltdowns where I'm like, I don't want to live without her. I love her so much. Like, there's going to be a day where we're going to be without her, and like, it could be any day. Like, I hope to God she gets to live to old age and like she gets to pass away peacefully in my arms. Like, what if I'm gone? Like, but I wouldn't not get her. I wouldn't change a fucking thing because I love every single day I get with her. I cherish every day. You guys know that. I love all of my fucking animal babies and human babies. And like I said, I can't really explain too much about dissociation because I'm just now I'm going to be 39, I'm 38 years old, learning what it is and how it affected me in my past. So once I know more, I will talk to you guys about how I disassociate. Okay, so that's my mental. That took like 35 minutes. Now, my physical disabilities, I have a form of something called Ehlers-Danlos syndrome. It is a connective tissue disorder. It affects everything in my body. So basically think of it as it's a generalized hypermobility spectrum disorder. Generalized means it's in more than 5 areas, like 5 joints in my body. Hypermobility means I'm more mobile this way. I can stretch back further and I can stretch forward further. So spectrum disorder, it's just like it's all over my body. So it affects my ligaments, my tendons, my muscles, and my organs. So everything is too loose, which causes a lot of injuries. I've sprained my ankle hundreds and hundreds of times. I've dislocated my shoulder because my ligaments were too loose, so it would fall off the back of my scapula. I constantly dislocated my hip because I had tears in my labrum ring. I tear very easily. So if you get a sprained ankle, I get a sprained back. I tear my tissues, and it takes a very, very long time for me to heal. So when I sprain my ankle, it takes some people 6 weeks in a boot, right? It takes me 16 to 18 weeks in said boot. It just takes a very long time for my body to heal. So sometimes when I would injure myself and not heal the proper way, what they do is they cause knots and trigger points, which is just basically a damaged muscle. I would tear or it's fibrous tissue just congregates into that one area that's damaged, that doesn't get healed properly, and then more knots, and you get like a cluster of knots. And then a trigger point is a knot in a trigger point. So I can touch this part of my arm and it hurts right there. And then there's other parts of my body where she'll touch and it'll send shoots of pain up or down my body. Or she'll do my back and I can feel it over here in my ribs or down here inside my hip socket. Those are trigger points. So I had those all over my body. I've been going to advanced physical therapy twice a week. In August, it'll be 2 years I've been going. I think I might have like another 1.5 to 2 years. We still have to finish my arms, my legs. We're going back to my back. My butt's really feels so much better than it used to. My whole body really feels so much better. I can do so many things that I never could. I can squeeze a fist without crying. I can make a muscle. I can do everything in my life better. I'm not completely healed. We're still in the we're not even in the maintenance part yet. So, gosh, how much more can I explain the GHSD? I think that's pretty. I think I explained that pretty well. And then because it's a connective tissue disorder, any of my organs can be affected by it. So my bladder is, and this is embarrassing, but I used to pee my pants all the time. And I always had the urge that I had to go to the bathroom and it would come on really quick. Well, that's because my bladder is loose. I don't know how to really explain that. Um, so it doesn't tighten when it's supposed to, and I just go to the bathroom. So I've been on bladder medication, I think, for over 2 years now, and it really, really helps out a lot. Um, my uterus is affected. Every time I had my period, I wouldn't get rid of the tissue, and I had a lot of swelling. It kind of looked like New York City in there, just like the New York timeline with all these like tall things of tissue. And he had to scrape everything out like a cantaloupe, he said, and he did. My walls were pretty thick on all sides. And I've been in pain a very, very, very long time. I mean, since I first got my period, I've been in pain. And I didn't realize how much pain I was in every fucking day, every second of the day, until he scraped everything out. He burned my uterus wall, and he took my fallopian tubes that had a bunch of cysts on them out. And my pain after the surgery, a couple of weeks went by, and I was instantly better. So I don't have to do anything for that. I just had to have surgery. My eyes are affected. They swell and unswell and swell and unswell. So I now have astigmatism, which is just your eye shape is not the right shape it's supposed to be. And when light goes in, it kind of is like a disco ball, kind of. And it causes a lot of pain for me. I cannot have, like, I have a horrible glare problem. So I have 3 different types of glasses that I wear for them. I also take an anti-inflammatory eye drop, a prescription eye drop. And then I also have the artificial tears. It's somewhere here. It's an advanced eye drop. But not only that, I also have dry eye disorder where you go to blink and the water covers your eye and it's supposed to keep it lubricated, and mine dries out completely. So that's what the prescription is for. And then I have to wash my eyes with a certain tea tree wash. And then I also have to use a brooder mask, which is basically a heating pad for your eyes. And it's because my glands are disappearing at the bottom and I'm not producing enough oil. So basically my eyes are super, super dry and painful. The glare's really bad from lights at night when it rains at night, and that the light from my car headlights reflecting off the rained gravel hurts my eyes. The sun and the snow. So even some certain lights hurt my eyes. So that's how my eyes were affected. I also grew up with horrible asthma, bronchitis, pneumonia, strep throat, ear infections. I was sick so much, and I had such horrible breathing problems. So my lungs were affected then. I used to have to take Prevacid for my stomach and my esophagus because those used to bleed and swell. I produced way too much acid, which made me sick and throw up all the time. I've lost like 12 teeth because of throwing up. Let's see, what else? I've had vertigo for the past 5 years because I had the flu for like 52 days or 58 days. I can't remember how many days it was. It was a long time, so I've been suffering from vertigo for a while. Kayla at Advanced Physical Therapy, she's helped me with that. I feel so much better. It was like having the beginning of the flu and being drunk and having the onset of a migraine all the time, nonstop. And I had this pressure here, and behind my eye, and I was constantly dizzy and nauseous all the time. So she's helping me heal that. Now I'm doing a bunch of like eye exercises where I have to, move I'll show you guys that too. But now, testing me for vertigo, she has found out that I have a certain heart problem. So I've been testing my blood pressure, and like today, it increased. Oh, I think this is backwards. So you lay down, you test your blood pressure, you wait 5 minutes, you sit up, test it again, wait 5 minutes, and then stand up and test it again. So when I laid down, it was 119/59. I sat down, I sat back up, it was 131 over 89. So both of them raised, one raised by 20 and the other raised by 30. And then I stood up and it was 138 over 102. So I've been testing it for the past couple of days. So they wanted to get me in today, but I'm going in tomorrow. I'll write it on the screen what Kayla thinks it is. So I'm going, like I said, tomorrow to see my doctor to see if I need to go on medication or do like a stress test or whatever. I also have fibromyalgia. I've been diagnosed that like 12 years ago. I don't know much about fibromyalgia. I just would get really, really fatigued from the lightest things. I haven't really looked too much into fibromyalgia because I thought it was a disorder that they gave to somebody when they couldn't figure out what was actually wrong with you. I didn't realize it's actually a disorder. So I have the fibromyalgia, and then I had horrible low vitamin D. So I went on a 12-week regimen of 50,000 IUs of vitamin D per week. Plus I took 4,000 IUs over-the-counter drug every day for 12 weeks, and now I'm on 4,000 IUs per day every day because my vitamin D drops every fall and winter. So I just stay on vitamin D every day, and I get it also in my multivitamin. And then I also have, like I said, this fascia disorder. So I do see Kayla for that as well, and she does these fascia releases where they hold down the area and they slowly like push out for 5 minutes. Every part of your body, even your cells, are surrounded by fascia. But once I understand more about that, I will talk to you guys about that. I also have tendonitis, like I said, all over my body, and that's when you get injured and injured and injured over and over and over again, and then your tendons are affected. It's like inflammation. So basically think of it as I have inflammation all over my body in like everything. I have arthritis in my spine, in my right knee, in my shoulder. I have bursitis in my knee, my hip, and my shoulder, which is your bursa sac. It's basically what cushions everything inside, and it fills with fluid. So when it would fill, it would push my bones out of the way, and I would dislocate myself as well. And then, like I said, I'm just now learning about my heart problems. So when I wrote this whole list down, I just lost my shit, and that's why I couldn't stop crying. It's really hard for me to talk about all of this, but I'm really glad I feel a lot better now that I've said it all, because even though this causes me a lot of pain to think about my past, I got through all of this, and I'm still getting through all of this every single day, especially my physical disabilities. And once I was able to help heal my pain more, I was able to start help healing my mind, and thinking more positive. Like, yes, I've had to deal with all of this, and I still do deal with this on a daily basis, but I just had my 3-year anniversary of when I basically was like, enough is enough. I am so fucking tired of this pain taking everything in my life away from me, and dictating what I do every day, every second of the day. I want to take control back. So I knew that I had to start eating properly. What I was putting in my body wasn't helping me. It was making me gain more weight, which was making me not be able to do anything. I would do the simplest exercise and be out of commission for sometimes days or weeks or months at a time. I would turn and actually sprain my back. I would tear the muscle from your rib to your pelvis. Like, the simplest things. I would twist my wrist and I would sprain my damn wrist. So seeing Kayla and having her help me learn a lot about my body and take care of myself, and when I do injure myself, what to do with ice and heat and pain meds and stability and I think it was May of 2017. I injured myself really badly, and I was in bed for 5 straight days, and my son was basically my nurse. Not basically, he was. The most humiliating part for me was not even being able to bend over a little bit to wipe myself when I went to the bathroom, to take a shower, to put my bra on, to clean my body, to put my hair up, to do anything. I would go to my sister's house and watch my nephew for a few hours, and I couldn't do anything for like days at a time. And now I can. I can go over there almost every single day and help her, or you know, I can go for walks almost every single day now because of what Kayla's been doing for me and what she's been able to teach me to help myself. And I got my own gym up here in the studio, and like I've changed so much about my life, and I felt like if I talked about these things and what I've been through, I think that other people would understand, because a lot of it you can't see. This is all the inside of my body. It's not like a big giant scar and a cut and an injury that you can see. So it was really hard for my friends and family to understand what I was going through, or strangers, because you can't see my mental and my physical disabilities. They're all inside my body. So I really, really hope that this has already made me feel better. I've already stopped crying. I just hope that maybe my story and what I've gone through could help you be an advocate for yourself and take control and get help that you need. There is nothing wrong with crying, with being broken, with feeling like you can't make it, and to seek help, because you are your own advocate. You are the one to ask the doctor for help, or maybe your friends and family can ask for you. But I wasn't going to get better until I made myself better, and until I made the steps to get better. And I believe in you. I believe that even if you're in the most severe pain like I was, that there's a way to fight for yourself. There's a way to get through it. And I did, and I'm so glad I did, because I absolutely fucking love my life. And I love how I feel about myself. I have made previous videos showing what I do in advanced physical therapy. I've gone to so many different specialists. I didn't even get into that. I'm going to go spend time with my son before he goes to work. I love you so much, and thank you so much for listening to me. I really, really, really